आसीबो ए विषय रे आज पूरा फुल चर्चा करिवा हमें आउ रिवर्सल आज डे 1 देन डे 2 रे हमें चर्चा करिवा आपनकर डाइट ऊपर कोन खाइबा कोन पीबा ता ऊपर चर्चा करिवा आउ डे 3 रे आपनकर हमर 1 ईयर प्रोग्राम्स विषय रे जानि परिबे ईजीएल लिस्ट विषय रे जानि परिबे ए सब विषय रे हमें चर्चा करिवा सो बिल्कुल आपण प्लीज रेडी विथ द नोट्स एंड इफ एनी डाउट्स यू कैन ask me at the end also ठीक अछि yeah so many people ready and just sharing one of the video so please watch complete okay किछि मिस करंतुनी आउ जदि किछि डाउट रहला आपण चैट बॉक्स रे पचारि परिबे so yes opposite direction okay suppose आपण गाड़ी चलोचन you go to the hill station right off and off you need to reverse it reverse gear of the gadi right so you need to go to back okay so suppose if you are taking insulin medicines the amount of and doses of that going off and off gradually coming jibo okay and आपण को देखिबे सुगर लेवल भी नॉर्मल हे जिवो किछि दिन पर मेडिसिन्स भी स्टॉप हे जिवो इंसुलिन भी स्टॉप हे जिवो and you normalize your blood glucose blood pressure readings also you're free from the any complications of diabetes remember diabetes write in your notes also diabetes is a silent killer diabetes is a silent killer just write in your notes why I am call it silent killer ଆପଣଙ୍କର जो ब्लड ग्लूकोज स्पाइक ହେଇକି ରହୁଛି इंसुलिन रेजिस्टेंस ରହୁଛି ଆପଣଙ୍କର डिफरेंट विसरल ऑर्गन्स रे फैट को डिपोजिट करता है यस आई हैव सीन a lot of cases फैट को डिपोजिट करता है ओके suppose I am giving one example you are taking insulin right those who are taking insulin just type I in the chat box those who are taking insulin just type I in the chat box okay I want to check how many of people are taking that okay so what it do it first take out the glucose from your blood okay ଆପଣଙ୍କ blood ରୁ ସିନା glucose କମିଯିବ but that will get deposited and in different parts of the body when insulin resistance develop and sometimes ଆମେ ଦେଖିଛୁ ତାଙ୍କର ଓଜନ ବଢି ବଢି ଯିବ sometimes ଆମେ ଦେଖିଛୁ ତାଙ୍କର ପେଟ ବଢି ବଢି ଯିବ ମୁହଁ ଫୁଲି ଯିବ ଗୋଡ ଫୁଲି ଯିବ you know fatty liver ହେବାର ବେଶୀ chances ଥାଏ like that so in reversal what we do we gradually taper that insulin doses medicines doses as per their as per their reports also okay so they free from the diabetes complications also जो complication तांको हेबार थिला ସେମାନେ free हेई परिबे they will also weight loss ହେଇଯିବ ତାଙ୍କର they will also look younger and become fit okay those who get understand this reversal just type RR in the chat box just type RRR reversal in the chat box okay it's also called remission nowadays you know reversal means complete extermination of the disease cure but remission means partial reversal is called remission yes it is Sri Mohanty madam thank you so much Nimaya so thanks a lot those who are typing because reversal meaning आपण बुझिले next step को आपण जाई परियो what to do for that okay let me show you some of the things what is called some examples right see this is the success story you know his name is Mr. Bhavani Prasad Patnaik he joined my program and his weight was 86 kg but now 70 kilo he was taking 8 tablet and now no tablet he was taking no any tablet yes within after this is the result after 3 months okay you can see his abdomen size but now the abdomen size is reduced okay yes you can see swelling of the face but now face is not swelled you can see the double chin feature just double chin feature mota hi jaye mota facial look it will change to like this transformation you can see HbA1c that is 13% this is the gold standard test को आ जाता है HbA1c को and it is 6% now ppbs 210 but now 120 now okay you can see the fasting blood sugar 280 but now it is 99 without medicines Before he was taking 8 medication, 8টা medicine ଖାଉଥିଲେ. Along with he was also blood pressure. But people cannot believe that blood pressure also reverse. Okay. But in my program, hundreds of patients already also stopped their medication with my guidance, proper guidance, right? So these are some, not only one story. I'll see you a lot of success story, okay? Not only one story, When you go to, yeah, so many people are typing reversal RRR. This is the meaning of actual reversal, okay, friends? Yeah, and this is possible because of their understanding. ମୁଁ ଯାହା କହୁଛି ତମକୁ ସେମାନେ ବୁଝୁଛନ୍ତି ତାଙ୍କ notes ଆପଣ ଦେଖିବେ they will make notes like my medical students. I teach in a medical college to my medical students and they all make their notes very clear. Okay. I make all the points very concise. Meaning of reversal. All you type RRR. Thanks a lot. Like this. Then some examples show କରିବେ ଆପଣଙ୍କୁ. Then some proofs, some beliefs ଆସିବ ଆପଣଙ୍କର. Then ଆପଣ step by step plan କରିବା. Okay. So when you go to my YouTube channel, you so many lot of other videos also. When you go to my YouTube channel, not only one video, you can see a lot of video. This is my YouTube channel, right? Yeah. You can go to my YouTube channel, just type Dr. Madhav in the YouTube channel. I'll share you the link also. Okay. I'll share you the link also. But when you just go to YouTube channel and type my name also, just we type Dr. Madhav, THAB, and NAYAK, diabetes, DIABETES. Just you type like this also. You'll get a lot of videos of mine. See, this is a live video going on, and you can see in the YouTube also. Okay. Yeah, and so many news channel come. This is the Argus news channel, Argus News, and so many other news channel. You can see this video. This is one of my programs video where I taking my classes to my patients. This is practical classes, 42,000 view of this video, So many videos. This is my direct protocols video, my plant proteins and animal, everything I have explained very clear. People are asking, show me the videos of your life, how to start all these things. So this is all these things. This is my camp programs details also you can see, So when you go to my channel, you click that channel. Okay. When you click that channel, if you want, upon this ଚାହୁଁଛନ୍ତି members ହେବା ପାଇଁ, ଆପଣ join that and you can also be a member of our channels so that you can watch others video also, That means someone unlisted video ଯୋଉମାନେ members ହୁଅନ୍ତି ତାଙ୍କ membership ମିଳିଯାଏ ଏଥିରୁ join କରିପାରିବେ ଆପଣ ୟାକୁ ନେଇକି ବି not an issue but you can go to other video also you can see the video section. Okay, so how the people have reversed their diabetes, how they are a success story, so many success story in my programs. They have come, they have joined and see their result. I have give all these things practical seasonality. Okay, that's why in my program you cannot believe in this thing indirectly. That's why I show all these proofs to you, how they have reversed and all these things. So you can also see this thing. Just type in the YouTube Dr. Madhab Nayak diabetes, and you can also see a lot of video. Okay, you can see, yeah, there is an N actually, but it will guide you. Okay, diabetes, yeah. So when you see this thing, you can know yes, this is possible. And how to possible? This is a step-by-step guidance, right? I'll give this guidance to all of you. And you can keep a success story of more than 500 patients in my YouTube channel also. Okay. So this is for your belief purpose. I am showing it to you. Okay. Next, I jump to my program. Okay. So let us jump to what to do for next. Okay. So that's why I do step by step things. So many patients, this is a one of patient Guru Prasad Dura. He was 97 kilo, but now 82 kilo, not 92. He was also taking around 8 medicines. He was on insulin at 10 unit, but now not taking any insulin. Okay, so however, a lot of people of this transformation you can see, not only one patient. I have showing all these reports before, afters, and all these things. So are you ready to check this challenge? Just type yes in the chat box. This is challenge for you, Challenge in the sense ki you can able to tell your what? You can able to tell your friends, relatives, colleagues. Yeah, I can also able to reverse my diabetes. So If you're ready, just ready in the chat box so that we can start the class session very soon. Okay, what is diabetes, what are the types of diabetes, and all these things. Because basic ଆପଣଙ୍କୁ ବୁଝିବାର ଅଛି କୋଉ type reverse ହେଇପାରିବ କୋଉ type reverse ହେଇପାରିବନି everything is I'll clear. Now just type. Is my slide is visible? Yes or no? Is my slide is visible? Yes or no? Yes. Chalo. Very good. Visible. Okay, those are ready. Just thank you so much. It is Srimanti Bipin Patti sir. Ready? Very good. Chalo. Without any delay, start noting down the points जोटा ମୁଁ କହୁଛି ଆପଣଙ୍କୁ because ଆପଣ ଟିକେ basic ବୁଝିବା କୋଉ diabetes reverse ହେଇପାରିବ କୋଉଟା ହେଇପାରିବନି everything I'll tell you in my program. Okay. Very good. Chalo. This is challenge for you. Thanks for typing yes. And this purpose is to very simple because you have no time now for your health. ସେଥିପାଇଁ ଆମେ କଣ କରୁଛୁ ଆମର ସିମ୍ପଲ ୱେରେ ଦିସ୍ ମେଡିକାଲ ସାଇନ୍ସକୁ ଆମେ ଆପଣଙ୍କ ପାଖକୁ ପହଞ୍ଚାଇବାକୁ ଚେଷ୍ଟା କରୁଛୁ to reverse this kind of chronic disease like diabetes, blood pressure, gastric problem, obesity, thyroid problem, Alzheimer's disease, high cholesterol, high triglyceride, all this kind of lifestyle disease, it's because of sugar. Yeah, it's because of sugar, it's because of diabetes. So this is what my purpose to empower you and those who ready for empower of all these things to grasp this knowledge because जब तक आपण ए knowledge को grasp करिवेनी only medicines पछरे धाइबे this meeting is not for that people. Okay, my mission is this thing to empower that people जो माने ए विषय knowledge किछि रखी नांती. And with this empowerment technique I got that thousands of results what I've shown just before you. So in that thing, who can attend this program? Before it was 5 days actually, but now it is 3 days. Who can attend this program and pre-diabetes, diabetes patient, those who are taking medicines or insulin, PCOD, blood pressure, all these things patient. ठीक ଅଛି? So I'm just going to topic proper key what is diabetes and where we need to, yeah, there are some lies also, but we discuss the lies later. So yes, come now. So there are some myths versus facts in diabetes. Then let's type in the chat box. The 5 biggest lies on type 2 diabetes. Okay, let's type in your notes. Okay, because lies is very important. ଆପଣଙ୍କ mind ରେ ସେଇ confusion ଏବେ ବି ଅଛି lies. If you not clear that lies, that causes problem. You cannot reverse diabetes. Okay, so just type the 5 biggest lies on type 2 diabetes. Okay, so first lies, once you have diabetes, you must need to take medicines for lifetime. Okay, this is the lies. But I'll just show you that patient, जो मैंने already reverse करी सारिछंती, जो मैंने so many patients have reversed it. So this is the lies. This is the truth is you can also have a medicines free life. You can also have a insulin free life. Yes. ଯେମିତି previous patient ମାନଙ୍କର ଦେଖେଇଲି ଆପଣଙ୍କୁ. Okay, second lies बहुत लोग आपण जानिथिबे. Once you have diabetes, you cannot eat coconut, you cannot eat ghee, mutton, and all these things. ମାଛ ମାଂସ ନା କିଛି ଖାଇବେନି ବୋଲି ମନା କରାଯାଏ ଆପଣଙ୍କୁ. It's a wrong science, actually, old science. But now, new science already evinced, and that tell you can also able to tell that eat that. Okay. So how to take that and all these things ମୁଁ ସେ ବିଷୟରେ ଆପଣଙ୍କୁ ଜଣାଇବି. Okay. Lies number 3. If your parents are diabetic, you always become a diabetic. ଏମିତି କୁହାହେଇଥିବ. Parents are diabetic ଯଦି ହେଲେ ଆପଣଙ୍କୁ ସବୁବେଳେ diabetes ହବ ବୋଲି କୁହାହେଇଥିବ. But this is also not true because in reality you can have a very diabetes free life even your parents have diabetes because the genetic role is only 15 to 20%. Rest other percentage is your lifestyle or your diet, environmental factors. Okay. You must follow a very strict diet plan. But remember, my friends, it's not very strict, but understanding the diet, understanding the EGL principle, estimated glycemic load kono, who diet nebe, kemti diet ro estimated glycemic load kom karibe, okay, which is good for you. All this knowledge is very important. Okay. So that's why it is called a program where we give the guidance. It's a coaching program. We will coach you. Okay. And the truth is that you can have a very flexible and variety of foods to eat. Just meeting start କରିବା ଆଗରୁ ଯେମିତି ଆମର ନିର୍ଭୟ ବାବୁ ଆମର 1 year program join କରିଛନ୍ତି ସେ ଯେମିତି ଆପଣଙ୍କୁ ଜଣେଇଲେ you can also able to stop that. Yeah. So type 2 diabetes can be never be fast. What is the meaning of that? Intermittent fasting, right? But remember, my friends, in reality, the intermittent fasting shows a very miraculous results in type 2 diabetes. And that's what I guide you. Okay. But this is the problem statement now. So many people in India now, more than 101 million people have diabetes. 101 million people have diabetes. And the number is going on increasing day by day. Why? Because people have no knowledge on reversal, right? Because they are not reversing their diabetes. That's why the medicines number, dosing, and all these things gradually increasing day by day. Okay, friends. So ଆମେ ସେଥିପାଇଁ ଆପଣଙ୍କୁ reversal knowledge କୁ ପ୍ରଥମେ focus କରିଥାଉ. So that upon once you have got this knowledge, then you can also clear your doubt also, right? Okay. And this is the problem, This is the ICMR studies, Indian Council of Medical Research. More than 101 million people have diabetes by India today. So କହିବାର ମାନେ ହଉଛି କଣ କି because ଆମେ once ରୋଗ detect ହେଲା ପରେ ଆମେ ତାକୁ reverse କରୁନୁ ଆମେ ତାକୁ ବଢେଇ ବଢେଇ ଚାଲିଛୁ 1 2 3 4 like that because we have no knowledge on this thing and this is the problem now. Okay. So but remember 1 in 11 diabetes 11 adults has diabetes adult onset diabetes 1 in 11 ମାନେ ଦେଖନ୍ତୁ 11 ଜଣରୁ ଜଣକୁ diabetes ହେବେ. So problem is that people have no knowledge on this reversal. That's why the number is increasing. This is the prevalence of diabetes. ଆପଣ ଦେଖନ୍ତୁ କେମିତି ବଢି ବଢି ଚାଲିଛି world wide prevalence. Okay. 2005 ରେ କେତେ କମ ଥିଲା 2040 expected ଦେଖନ୍ତୁ ଆପଣ 642. Okay. Millions expect କରାହଉଛି. So many number. So ପଳେଇବା basic knowledge କୁ what is diabetes ଆପଣ ସମସ୍ତେ ଜାଣିଛନ୍ତି. ବ୍ଲଡ ସୁଗର ବଢିବାଟାକୁ ଡାଇବେଟିସ୍ କୁହାଯାଏ ବଟ୍ ମନେ ରଖନ୍ତୁ ଯୋଉ ବ୍ଲଡ ସୁଗର ବଢୁଛି କଣ ପାଇଁ ବଢୁଛି ଆଇଦର ଆପଣଙ୍କର ଇନସୁଲିନ ହର୍ମୋନ ପ୍ରଡକ୍ସନ କମି ଯାଇଛି ଅର ଆପଣଙ୍କ ଶରୀରରେ ଇନସୁଲିନ ହର୍ମୋନ କାମ କରୁନାହିଁ. Basing upon these two things, we guide you that which kind of diabetes you have. Okay. Basing upon these two things, we guide you which kind of diabetes you have. You have either type 1 or you have type 2 like that. Okay. So, our main purpose ଥାଏ କଣ କି ଆପଣଙ୍କୁ basic knowledge ଦେଇଦେଲା ପରେ ଆମେ ତାପରେ guidance ଦେଇଥାଉ. So, listen to this basic knowledge, then we also guide you properly also for that. Okay. Yes. So, diabetes reversal, yes, diabetes ର actual meaning ହଉଛି କି blood sugar ଆପଣଙ୍କ blood level ରେ normal glucose ଠୁ ବଢିଯିବ and suppose I just giving you example fasting blood sugar ଆପଣଙ୍କର ଯଦି more than 126 ଲେଖିକି ରଖନ୍ତୁ just write in your notes if the fasting blood sugar ଖାଲି ପେଟର sugar more than 126 is called diabetes. 126 is called diabetes. Second, if your PP blood sugar, high cellular blood sugar, after 2 hours of food, if it is more than 200, it's called diabetes. Okay. Or RBS, random blood sugar, if it is more than 200, it's called diabetes. Your HbA1c, that's called glycosylated hemoglobin, HbA1c level, if it is more than HbA1c level is more than 6.5, 6.5 is called diabetes. Write the points. 3 points ମୁଁ କହିଲି ଏବେ ଆପଣଙ୍କୁ କଣ କଣ କହିଲି? Yeah. Very good. First point, fasting blood sugar more than 126 is called diabetes. Very good. Yes. Second, your red ଖାଇ ସାରିଲା ପରେ sugar, random blood sugar ଯଦି more than 200 is called diabetes. Yes. Then third point ମୁଁ ଆପଣଙ୍କୁ ଆଉ ଗୋଟେ କହିଲି HbA1c, that is called glycosylated hemoglobin. Okay, glycosylated hemoglobin. Yes. Very good. If it is more than what? 6.5 is called diabetes. Very good. Okay. Yes. Then आमे डायबिटीज को डिटेक्ट करिया पे आउ किछि टेस्ट होछि कि लोक कोन करंती सेही टेस्टिंग किछि करि न थांती राइट मु सेही विषय रे भी आपन को टिके जणे देबी व्हाट टेस्ट शुड बी डन एंड व्हाट टेस्ट शुड नॉट बी डन बिकॉज एबे बहुत प्रोटोकॉल चेंज हो गलानी आपन केबे प्रोफाइल टेस्ट करू नथिले नो वी हैव सो मेनी प्रोफाइल टेस्ट ऑन दैट प्रोफाइल टेस्ट रो मीनिंग कोन आमे कहितौ जो टेस्ट रे आमे जानि देबा कि आपनकर आउ कोन कोन प्रॉब्लम्स अछि okay so just I'll show that some testings also ମୁଁ ଆପଣଙ୍କୁ ଦେଖେଇଦେବି ଆପଣ କେବେ ଫାଷ୍ଟିଂ ଇନସୁଲିନ ବିଷୟରେ ଜାଣି ନାହାନ୍ତି ଆପଣ ଇନସୁଲିନ ରେଜିଷ୍ଟାନ୍ସ କଣ ଜାଣିନାହାନ୍ତି ସେ ବିଷୟରେ ବି ଆମେ ଟିକେ ଚର୍ଚ୍ଚା କରିବା ଆମର ପ୍ରୋଗ୍ରାମ୍ସ ଡିଟେଲ୍ସ ରେ एंड बिकॉज जब तक बेसिक नॉलेज न हो ଆପଣ ଜାଣି ପାରିବେନି so let me show that things to you okay quiz yes okay चलो so diabetes कौन हुए आपण इधर only medicines ऊपर डिपेंड करती your the medicines number increasing day by day and that causes problem and the practice guidelines are all focused on this drug management not on reducing the medications no any practicing guidelines now for to taper your medicines but this is the problem now that's why आपन medicines tapering केवे होनी okay so tapering को हमें focus करता हूं in my programs just go to basic anatomy कि yes this is the your liver okay this is your liver এটা হচ্ছে আপনার liver this is the abdomen and this part is called pancreas you can see that okay yellow part pancreas is in odia it is called agnasya odia रे कौन कुआ जाए को very good agnasya कुआ जाए okay it's called agnasya okay agnasya in odia it is called agnasya okay चलो very good in odia it is called agnasya okay so chalo just just a minute I'll show you one thing ha in odia it is called agnasya okay so एथिरे कोन हुए insulin production हेई थाए एटा होची आपनकर different parts of the pancreas you can see that things okay and gradually कोन हुए तारो हम यदि histology नबा ना basic anatomy that content beta cell गोटे देखंतो आपनकर beta cell जो insulin production हेता है yes remember my friend this is a beta cell and where the insulin is produced insulin hormone beta cell ru produce हेता है मन रखंतो yeah एवं जो insulin hormone production हेता है that's a very important hormones to know and to your particularly कोन आपनकर कंडीशंस जानिया पई आपनकर particularly yes just a minute okay so केते इंसुलिन प्रोडक्शन होची इंसुलिन प्रोडक्शन रो क्वांटिटी केते जदि आमे देखितो बहुत केस रे टाइप 2 डायबिटीज केस रे इंसुलिन प्रोडक्शन सफिशिएंट होथाय किंतु बीटा सेल्स काम कर न थाए से केस रे बीटा सेल माने सेंसिटिविटी कमी जाय थे से केस रे देखो रेजिस्टेंस बोली को आज ता विषय रे गोटे रिपोर्ट मु आपन को देखौची जस्ट हाउ टू नो दैट ओके जस्ट आई एम शोइंग यू वन रिपोर्ट्स ओके को टेस्ट आमे करतो से विषय जनको रिपोर्ट आपन को देखो जस्ट आई एम शेयरिंग द रिपोर्ट्स see this is a one report so we advise our patient to show their homa ir test कई करंतनी but we practice to do in my programs जो थरे आपन को बीटा सेल केते परसेंट काम करजती anybody has tested that things just type in the chat box जो माने टेस्टिंग करछती बीटा सेल केते काम करछि nobody okay चलो yeah सो ए जे जो बुझेली आपन को पानक्रियास थाई पानक्रियास रे गुटे बीटा सेल अछि बीटा सेल जदी ठीक से काम कर नथिबो ताहले भी डायबिटीज हेबो एवं आपन को इंसुलिन जदी बाहरुछि एवं इंसुलिन काम करूनी ताहले भी डायबिटीज हेबो राइट सी पीपल या भीतर डिफरेंस जानि पारथिनी जस्ट लेट मी शो यू वन रिपोर्ट ओके okay so I hope you can see this homa ir2 report see this is the report you know होमा आयर टू केमती एक्सप्लेन करा हिची देखंतु आपण देखो गोटे पेशेंट कर मु रिपोर्ट आपको देखौछि यू कैन जस्ट सी दिस थिंग ग्लूकोज देखो एथरे कोन ग्लूकोज फास्टिंग अछि 127 इंसुलिन फास्टिंग अछि 6.5 16.5 बीटा सेल फंक्शंस अछि 82% दैट शुड बी मोर देन 100 अपन लिखि रखतो normal beta cell function should be more than 100%. Okay? But तांको केस रे 82% अछि देखतो. But insulin sensitivity 43%. Insulin sensitivity 43%. That should be more than 100%. So it is typical case of type 2 diabetes. बुझी पारले? Anybody had done this test? Just type I in the chat box. Anybody have done this test? Just type I in the chat box because I'll also advise how to do this test. Okay, upon केमती test करी परिबे. How to do this test? I also give you the number for that test. No need to worry. Okay. So because ଆମେ ପ୍ରଥମେ କିଛିଟା ଡାଇଗ୍ନୋଷ୍ଟିକ ଭ୍ୟାଲୁକୁ ଯାଇଥାଉ ତାଙ୍କର ଆପଣଙ୍କ ଆକ୍ଚୁଆଲି ମେଡିସିନ ନେଇ ନେଇ ଆପଣଙ୍କ ବିଟା ସେଲ୍ କାମ କରୁଛି ନା ନାହିଁ ଯଦି କାମ କରୁଛି କେତେ କାମ କରୁଛି एंड तार हिसाब रे आमे आपनकर डाइट टाକୁ मॉडिफाई करथौ यस ओके सो these are basic things for your understanding okay then I jump to the yeah, how to do this test and all this thing I'll jump to that also what is the name of this test okay just a minute ମୁଁ ଆପଣଙ୍କୁ ଶୋ କରିଦେବି not issue for that and because basic testing रे जଣା पड़िबो आपनको बीटा सेल केते काम होई बहुत लोक जानि ना था ए टेस्ट विषय ସେଥିପାଇଁ ସେମାନେ ଲାଷ୍ଟ କୁ ପ୍ରୋବ୍ଲେମ ରେ ପଡି ଯାଆନ୍ତି ଓକେ ସୋ ଦ୍ୟାଟ୍ସ ହ୍ୱାଇ I try to show that test to with you also okay so this is called diref advanced package just write in your notes this is called diref advanced package test diref in the sense ki diabetes reversal package test yes okay so let me show that image to you okay yeah those who want this test you can also do that आपण भी करि परिबे and different district रे भी आमो एई सेंटर अछि आपण ताको जस्ट मु देखै दोचे आपण को you can also have this knowledge on this test this is called direct advanced package test okay can you able to see my slide just type yes in the chat box can you able to see my slide my screen okay so this is called direct advanced package test yes, thank you. If you do it outside, it will cost around more than 8,000 cost पड़िगो but एते costly नुहो एटा आपण दि एथरे कोन आछे आपनकर विटामिन 102 टेस्ट आछे विटामिन प्रोफाइल विटामिन डी विटामिन B12 डायबिटीज प्रोफाइल आस्ताय आपनकर थायराइड प्रोफाइल लिपिड प्रोफाइल लिवर प्रोफाइल किडनी प्रोफाइल and HOMA IR analysis all these things so आपण कहबे सर ए टेस्ट सब करिया कोन दरकार yes कौन पाई देखंतु डायबिटीज रे मल्टीपल ऑर्गन्स रा कॉम्प्लिकेशन को धरते थाए बेले बेले सो वी नीड टू रूल आउट दैट आल्सो आपनकर किडनी कॉम्प्लिकेशंस लिवर कॉम्प्लिकेशंस एंड nutritional deficiency all these things so you just note down this number okay तले गोटे नंबर दिया है you can see this number yes or no देखंतु you can type the number 858 just a minute number आपनो शो हो न थिबो I'll share this thing in the group yes 858 590 8864 okay just type the number those who are watching my video so that आपण भी से नंबर को कॉल करके आपण को डिस्ट्रिक्ट रे कोठी हबो एंड ऑल दिस थिंग विषय रे बुझी परिबे ओके आउथरे okay just typing the number 85 8585 90 8864 okay this is one number another number ମୁଁ ଆପଣଙ୍କୁ ଶୋ कर ଦଉଛି ମୋର ସ୍କ୍ରିନ ରେ जोटा कॉल କରିକି ଆପଣ ବି ଏଇ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ କରିପାରିବେ Just a minute. I'll present that thing to you also because this test is very important to know the your progression status. Okay. ଆପଣଙ୍କ କୋଉ ଷ୍ଟେଜରେ ଅଛନ୍ତି ଡାଇବେଟିସର ରିଭର୍ସାଲ ବିଟା ସେଲ୍ କେତେ କାମ କରୁଛି ଏଇ ଯୋଉ ପାର୍ଟିକୁଲାର ବିଟା ସେଲ୍ ଅଛି ଏବଂ ଏ ବିଷୟରେ ମୁଁ ଆପଣଙ୍କୁ ଡିଟେଲ୍ସ ଜଣାଇଥାଏ ବିକଜ वी all need to know this thing also, you know. The number is 78944 ଆଉ ଗୋଟେ number 78944 06450 06450 78944 06450. Just a minute, ମୁଁ ଆପଣଙ୍କୁ expand କରିଦଉଛି so that you can also see these things. Okay. Okay. Is this number visible? ଆପଣଙ୍କୁ number ଦେଖାଯାଉଛି କି ନାହିଁ? Yes or no? ଦେଖାଯାଉଛି ଯଦି yes ଲେଖନ୍ତୁ because save this number for the testing. ଆପଣ ଯଦି any place ରେ ଓଡ଼ିଶାର ଚାହୁଁଛନ୍ତି you can do this testing. Okay. ଦେଖାଯାଉଛି 78944 06450. Yeah. ଭୁବନେଶ୍ୱରରେ ବି ହଉଛି ଭୁବନେଶ୍ୱରରେ ଆପଣ କଲ୍ କରିକି କରିପାରିବେ। ଓକେ ଓକେ ୟେସ୍ ଭିଜିବୁଲ ସୋ ଦ୍ୟାଟ୍ ଆପଣ କଣ ଆମେ କଣ ଜଣା ପଡିଥାଏ ୟେସ୍ ଇଟ୍ ଇଜ ଟୋଲ ଫ୍ରି ନମ୍ବର ଅଲସୋ ଆପଣ ଏଇ ନମ୍ବରକୁ ସେଭ୍ କରିଦିଅନ୍ତୁ ଏଇ ନମ୍ବରରେ ବେଟର ଯଦି ସେଥିରେ କିଛି ପ୍ରୋବ୍ଲେମ ହେଲେ ଏଇ ନମ୍ବରରେ ଆପଣ କଲ୍ କଲେ ଇମିଡିଏଟ ରେସ୍ପନ୍ସ ପାଇପାରିବେ ଆପଣ ଆପଣଙ୍କର ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂକୁ ଦେଖିକି ଆମେ କଣ କରିଥାଉ we progress according to the reversal as per your and diet according to that also. I mean diet को सही हिसाब से भी modify करता हूँ because everybody's body is not same, right? I'll show you another some reports also जो थे आप देखिए अन्य लोग मानकर केमती profile test vary करता है because समस्त नगर report same not है, right? And according to that we vary with our protocol and our program also. So basic program रे हमें किसी testing भी करता हूँ आपनों profile testing. And according to test ଆମେ ବେଳେ ବେଳେ CGM ବି some participant को install करता हूँ but CGM ସମସ୍ତଙ୍କୁ ଦରକାର ପଡେନି CGM ମାନେ continuous glucose monitor ଗୋଟେ ଅଛି yes but it's not to all because some participant need that some participant may not need that. Okay so yes. I am following the DIP diet last 4 years but my HbA1 6.3. What is DIP diet? Can you explain Sasikant Panda what is DIP diet? What is the full form of that? Is there any standard diet called DIP like that? Not like that, right? Okay. So many people are, false, they're following any false diet, They have no any scientific background. Okay. This is the problem. They cannot reverse their disease and finally they suffer with the problem. Okay. Yes. So that's why more. Okay. ଆପଣଙ୍କ ପାଇଁ personalized diet ହେବ it is your diet not any other's diet. Okay, it is your diet as per your reports. This is called personalized diet. ଆପଣ ଲେଖି ରଖନ୍ତୁ this is called personalized diet. ଆପଣଙ୍କ diet yes ଆପଣଙ୍କ ମାନେ ଆପଣଙ୍କ reports କୁ ନେଇକି ଯୋଉ diet ଆମେ ତିଆରି କରୁ and no such kind of diets like what I'm telling ki DIP diet VIP diet what is that here? All nonsense diet. Okay, so all you need to follow the diet according to your profile. Okay, what we advise to our participant also and in my programs because all you know need to know because ଆପଣଙ୍କର ଯଦି ବିଟା ସେଲ୍ କାମ କରୁନଥିବ କୋଉ ଡାଏଟ୍ ଆପଣଙ୍କୁ ସେଇ ବିଟା ସେଲ୍ କୁ କେମିତି କାମ କରିବ ସେଇ ଡାଏଟ୍ କୁ ଆମେ କହିବୁ ନା ଆପଣଙ୍କୁ ସୋ ଆମର ପର୍ପୋଜ ହିଁ ସେଟା ଥାଏ କି we advise you as per your basic reports. That's why we do some kind of testings also for that. And according to testings, we know co-condition re apanka pancreas achi and all these things, right? Yes. Just I'm showing some reports with you. Yes. Yeah. Suppose I just show ଗୋଟେ report ଆପଣଙ୍କୁ show କରୁଛି ୟାଙ୍କର beta cell କେତେ କାମ କରୁଛି जो माने करथिबे सब माने जानि देबे देखिबे एई टेस्ट से आमे देखि पाबा आपनका बीटा सेल केते काम करी देखंतु बीटा सेल फंक्शंस 82% माने कोन भलो काम कर चलिबो ताको 100 ऊपर आमे क्रॉस करे देबु हमरो प्रोग्राम्स रे without medication also insulin sensitivity केते अछि that means the opposite is resistance यांकर 43% अछि that should be more than 100% sensitivity right yeah so resistance अछि एक केस रे around 67% resistant अछि एक केस रे right so ଆମେ କହିବା ଏଟାକୁ insulin resistance diabetes or type 2 diabetes ବୋଲି କୁହାଯାଏ ଲୋକ ନିଜର type of diabetes ବିଷୟ ଜାଣି ନଥାଏ ତାଙ୍କୁ right so ଆମେ ତାଙ୍କୁ ତାଙ୍କର type of diabetes ବିଷୟ ଜଣେଇଥାଉ not only one test you can see other test also my friends vitamin D level ଦେଖନ୍ତୁ କେତେ low ଅଛି ଏ patient ର vitamin D vitamin B12 ଦେଖନ୍ତୁ 188 very very low okay this is the problem vitamin B12 କମିଲେ so many complication will come vitamin D ଦେଖନ୍ତୁ only 24 it's very very low ଏଥିପାଇଁ ଆମେ କଣ କରିଥାଉ ତାଙ୍କର ଲେଭେଲ କୁ ଦେଖିକି ଆମେ ଆମର ଡାଏଟ କୁ ଚେଞ୍ଜ କରିଥାଉ ମାଇ ଫ୍ରେଣ୍ଡସ୍ ୟେସ୍ या सी पेप्टाइड लेवल माने कोन आपनको पांक्रियास सतरे कोन काम करूची यस केते काम करूची जानिबा पई ओके सो मेनी एचबी1सी भी पळे आसीबो सेतरे ओमायर पळे आसीबो आपनकर माइक्रोअल्बुमिन पळे आसीबो लॉट्स ऑफ गुड थिंग्स विल फाइंड एंड अकॉर्डिंग टू दैट विल प्रिपेयर द डाइट इफ द विटामिन डी इज लो विल प्रेस्क्राइब a diet high in vitamin D okay eta hochi a importance of this testing my friend if you do the CBC test see your erythrocyte count is low or your hemoglobin is low PCV is low MCSC low then ଆମେ ଭାବିବୁ ଆପଣଙ୍କର ଆଇରନ୍ ଡେଫିସିଏନ୍ସି ଏନିମିଆ ତ ଆଇରନ୍ କୁ ଆମେ ଠିକ କରିବୁ ରାଇଟ୍ ଆପଣଙ୍କର ଯଦି ହାଇପୋଥାଇରଏଡିଜମ ଥିବ ସପୋଜ ଥାଇରଏଡ ପ୍ରୋବ୍ଲେମ ଥିବ ଆପଣଙ୍କର ସୋ ଆକର୍ଡିଂ ଟୁ ଦ୍ୟାଟ ୱିଲ୍ ଟ୍ରାଏ ଚେଞ୍ଜ ଦ ଡାଏଟ ଅଲସୋ ବୁଝିପାରିଲେ yeah so this is why my program is the best program okay because as this is a personalized program my friends I know personalized program in the sense D3 yes vitamin D3 ସେଥିରେ ପଳେଇ ଆସିବ yeah so that thing will come in that see HSCRP ପଳେଇ ଆସିବ ଆପଣ HSCRP ଯେ cardiovascular risk ଯୋଉମାନଙ୍କର HSCRP ବେଶୀ ଥାଏ ହାର୍ଟ ଡିଜିଜ ହେବାର ଫ୍ୟୁଚରରେ ଚାନ୍ସେସ୍ ଥାଏ ତାଙ୍କର ସୋ ଆମେ ତାକୁ ବି ଆମ ପ୍ରୋଗ୍ରାମରେ ଟେଷ୍ଟିଂ କରିଥାଉ ଆପଣଙ୍କର କମ୍ପ୍ଲିକେସନକୁ ଜାଣିବା ପାଇଁ କିଡନୀ କମ୍ପ୍ଲିକେସନ ଜାଣିବା ପାଇଁ ମାଇକ୍ରୋଆଲବୁମିନ ଟେଷ୍ଟ କରିଥାଉ ଓକେ ଆମେ ଆଉ ଗୋଟେ ଜିନିଷ ଆପଣଙ୍କର liver complication ଜାଣିବା ପାଇଁ LFT profile ପଳେଇ ଆସିବ liver profile test ପଳେଇ ଆସିବ you know so all these things see this is the liver profile test to know the you know globulin is 3.6 you know, all these things globulin SGOT SGPT will come why we do this kind of test my friend ମୁଁ ବାରମ୍ବାର ଆପଣଙ୍କୁ କହୁଛି what we measure that will improve what we measure just write in your notes ଏମିତି ଗାଲରେ ହାତ ଦେଇକି ବସିଲେ କିଛି ହବନି ଜୟପ୍ରକାଶ ସାର୍ ଆପଣ ଲେଖନ୍ତୁ notes ବୁଝିପାରିଲେ କି ନାହିଁ just try write the notes in your notes what you measure that will improve okay so where I am telling these things to you just this is the number you can save also for the testing those who want testing they can save this number take a screenshot of this number also take a screenshot of this number and you ask for the direct advanced test also okay don't chalo so ଆମେ ଯୋଉଟା ଡିସ୍କସ କରୁଥିଲେ ବିଟା ସେଲ୍ ଆପଣଙ୍କ ପାନକ୍ରିଆସ କେତେ କାମ କରୁଛି ପରସେଣ୍ଟେଜ ଜାଣିବା ପାଇଁ and all these things so ବିଟା ସେଲ୍ ର କାମ କେତେ ଅଛି ଜାଣିବା ପାଇଁ ଟେଷ୍ଟ କରାଯାଏ ଓକେ ଚलो ଦେନ୍ ଆମେ ପଳେଇ ଯିବା ଆପଣଙ୍କର କିଛି ପାନକ୍ରିଆଟାଇଟିସ ହେଇଛି କି and all these thing so ଏଟା ତ ଆଡଭାନ୍ସ ଜିନିଷ ବଟ୍ ଆପଣଙ୍କର ହାଉ ଇନସୁଲିନ ଆକ୍ଟ ବେଳେ ବେଳେ କେସରେ ଆମେ ଦେଖୁ ଟାଇପ 2 ଡାଇବେଟିସ କେସରେ ଇନସୁଲିନ କାମ କରୁନଥାଏ ସୋ ଆପଣଙ୍କ ରେଜିଷ୍ଟାନ୍ସ ଅଛି କି ୟେସ୍ ଅର୍ नो ତ ରେଜିଷ୍ଟାନ୍ସ ମାନେ କଣ ସେନ୍ସିଟିଭିଟିର ଜଷ୍ଟ ଅପୋଜିଟ ୱାର୍ଡ ଓକେ ଯଦି ଆପଣଙ୍କ ରେଜିଷ୍ଟାନ୍ସ କେସ୍ ଥିବ ତାହେଲେ ସେନ୍ସିଟିଭିଟି କମି ଯାଇଥିବ ଆପଣଙ୍କ ଫର ଟେଷ୍ଟ ଆଉଟସାଇଡ ଓଡ଼ିଶା ଇଟ୍ ଇଜ ଆଭେଲେବୁଲ ଫର ଟେଷ୍ଟ ଆଉଟସାଇଡ ଓଡ଼ିଶା ୟୁ କ୍ୟାନ୍ ଡୁ ଇନ୍ ଦ ଥାଇରୋକେୟାର नो प्रॉब्लम मैडम and we have a similar package in the thyrokeare also you can do that test in thyrokeare also I'll show that test package to you no need to worry if you want outside Odisha you save this number in Thyrocare anywhere outside Odisha in India you can save this number and this is the number for outside Odisha madam yeah you can save 9023 317 317 this is for outside Odisha or Thyrocare browser ଆପଣ କରିପାରିବେ you can save the number 90 23 317 317. This is a test package in Thyrocare also, but he'll give you 99 package test. You tell the direct advanced package. Okay, you tell the direct advanced package test. Just take a screenshot of this page. Okay, yeah, chalo. Then we jump to the, this is the things. Types of diabetes, ଆପଣ ସମସ୍ତେ ଜାଣିଛନ୍ତି. Types of diabetes, type 1 is equal to particularly ଛୋଟ ପିଲାମାନଙ୍କୁ ଯୋଉଟା ହେଇଥାଏ, ପତଳା ଦେଖିବାକୁ ବହୁତ ପତଳା ଦେଖାଯାଆନ୍ତି. Type 2 diabetes ଯୋଉଟା ବଡ ଲୋକମାନଙ୍କୁ ହେଇଥାଏ, mostly more than 70% କେସରେ this is type 2 diabetes. ଆଉ ଗୋଟେ ପ୍ରକାର ଅଛି, this is called gestational diabetes mellitus, ଯୋଉଟା କି ପ୍ରେଗନେଣ୍ଟ ମହିଳା ମାନଙ୍କୁ ହେଇଥାଏ. So ଆପଣ types of diabetes ଲେଖି ରଖନ୍ତୁ. Just write the type of diabetes. Okay. Just write the types of diabetes, type 1 diabetes, type 2 diabetes, and gestational diabetes. Okay. Just type. Why I'm telling these things? कि ଆପଣ ନିଜର କୋଉ type of diabetes ଆପଣ ବି ଜାଣିପାରିବେ. ତାର example ଦଉଛି ଆପଣଙ୍କୁ. ଯଦି type 1 diabetes ହେଇଥିବ, ଛୋଟ ପିଲାମାନଙ୍କୁ ହେଇଥାଏ, ଯୋଉଥିରେ ଆପଣଙ୍କ insulin production କମିଯାଏ. ଓକେ, ଯୋଉଟା type 2 diabetes, ଆପଣ ସେଥିରେ ଦେଖିବେ insulin sensitivity କମିଯିବ ଆପଣଙ୍କର. ମାନେ କଣ? ଇନସୁଲିନ ଥିବ କିନ୍ତୁ କାମ କରୁନଥିବ, ବୁଝିପାରିଲେ? ସପୋଜ ମୁଁ ଏବେ ଯୋଉ ଆପଣଙ୍କୁ ଏକ୍ସାମ୍ପଲ ଦେଖେଇଲି, ସପୋଜ ଯଦି ଗୋଟେ ଟାଇପ 1 କେସରେ ସି ପେପ୍ଟାଇଡ ପୁରା କମିଯାଏ, ହାଉ ଟୁ ଡିଫରେନ୍ସିଏଟ ଟାଇପ 1 ଆଣ୍ଡ ଟାଇପ 2? ଟାଇପ 1 ଡାଇବେଟିସ୍ ଆପଣ ଦେଖନ୍ତୁ ଛୋଟ ପିଲାମାନଙ୍କୁ ହେଇଥାଏ, ଛୋଟ ପିଲାମାନଙ୍କୁ, ବଟ ଟାଇପ 2 ଡାଇବେଟିସ୍ ବଡ ଲୋକମାନଙ୍କୁ ହେଇଥାଏ ପ୍ରାୟ। ଓକେ, ଛୋଟ ପିଲାମାନେ ଯୋଉମାନେ ଆଇସ୍କ୍ରିମ୍ସ, କୋଲ୍ଡ ଡ୍ରିଙ୍କ୍ସ and all these things ବେଶୀ ଖାଉଥାନ୍ତି, ଛୋଟ ପିଲାମାନେ, the junk food, ice creams, cold drinks, kurkure and all these things, junk food ଯୋଉମାନେ ବେଶୀ ଖାଆନ୍ତି, sometimes viral infection ହେଇଯାଏ, ତାଙ୍କର ଅଟୋ ଇମ୍ୟୁନ ଡିଜିଜ ହେଇଯାଏ। and ସେଥିରେ କଣ ହୁଏ ଆପଣ ବିଲିଭ କରିବେ, ମୁଁ ଯାହା ବି ଟାଇପ 1 ଏବେ କେସ୍ ଦେଖୁଛି, ତାଙ୍କର ଯେତେବେଳେ ହିଷ୍ଟ୍ରି ନଉଛି, ତାଙ୍କର ବାପା ମା ପିଲାକୁ ନେଇକି ଆସୁଛନ୍ତି, ମୁଁ ପଚାରିଲେ ସେମାନେ କହୁଛନ୍ତି ପିଲା ଜଷ୍ଟ ଡାଇବେଟିସ୍ ହେବା ଆଗରୁ କଣ ଖାଉଥିଲା, they are all giving typical history. ମିଲ୍କ ପ୍ରଡକ୍ଟସ ଖାଉଥିଲା ବହୁତ, ଚକୋଲେଟ ଖାଉଥିଲା ବହୁତ, ଆଇସ୍କ୍ରିମ ଖାଉଥିଲା, କୋଲ୍ଡ ଡ୍ରିଙ୍କ୍ସ ପିଉଥିଲା, and this କୁରକୁରି ମୁରକୁରି all this sugary food ଖାଉଥିଲା। ଏବଂ ଯେତେବେଳେ ଆମେ ତାଙ୍କର ଟେଷ୍ଟିଂ କରୁ, ସେ ପଚାରିଲା ପରେ ବି ସି ପେପ୍ଟାଇଡ ଲେଭେଲ less than 0.01, this is called type 1 diabetes। ମନେ ରଖନ୍ତୁ, ଯଦି ସି ପେପ୍ଟାଇଡ ଗୋଟେ ଟେଷ୍ଟିଂ କରୁ ଆମେ, ଆମର ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ ରେ ପଳେଇ ଆସିବ ସେଟା ସି ପେପ୍ଟାଇଡ ଟେଷ୍ଟିଂ। ୟା in this case ଗୋଟେ କେସ୍ ଏକ୍ସାମ୍ପଲ ମୁଁ ଆପଣଙ୍କୁ ଦେଖଉଛି, ଯୋଉଥିରେ ଆପଣ ଦେଖିବେ ସି ପେପ୍ଟାଇଡ ଗୋଟେ ଟେଷ୍ଟ ଲେଖି ରଖନ୍ତୁ, one test to differentiate type 1 type 2, this is called C peptide test, and this HOMA-IR test। Okay, so in this case ମୁଁ ଯୋଉଟା ଆପଣଙ୍କୁ ଦେଖଉଛି, this is a HOMA-IR report। ଆପଣ ଦେଖନ୍ତୁ insulin sensitivity 43%, ମାନେ କଣ? Resistance around 56%, so it is called type 2 diabetes। Okay, but beta cell function ଅଛି 82%, ମାନେ କଣ? କାମ କରୁଛି ବିଟା ସେଲ୍ ବି, ବଟ fully function କରିପାରୁନି, so it is called typical type 2 diabetes। Okay, but in this case କଣ ହେଇଥାନ୍ତା, ଯଦି type 1 diabetes ହେଇଥାନ୍ତା, ତା କେସରେ ବିଟା ସେଲ୍ ଫଙ୍କସନ୍ସ ଟା ଜିରୋ ହେଇଥାନ୍ତା, 0%, 0%, yes, but sensitivity 100% ଉପରେ ହେଇଥାନ୍ତା in case of type 1 diabetes। ଆଉ ଗୋଟେ ପ୍ରକାର ଡାଇବେଟିସ୍ sometimes called double diabetes। Okay, ଯୋଉ ଟାଇପ 1 ଡାଇବେଟିସ୍ ପେସେଣ୍ଟ ମାନେ ଇନସୁଲିନ ନଉଥାନ୍ତି ବହୁତ ଦିନ ଧରିକି, ତାକୁ ଡବଲ ଡାଇବେଟିସ୍ ହେଇଥାଏ, type 1 plus type 2 both। That's called double diabetes, I have seen that। Okay, okay, and this is the C peptide serum, you can see the C peptide report। Why I do this test? Because C peptide ଯଦି 4 ଅଛି, that means it is type 2। it assess the pancreatic beta cell function, ଆପଣଙ୍କ pancreas ର beta cell କେତେ percent କାମ କରୁଛି ସେଟା ସେ ଦେଖେଇଥାଏ। it distinguishes between type 1 and type 2। Okay, Sasikant Panda, you please stop the screen sharing। Okay, you please stop this thing। Okay, yeah, chalo, so this kind of things happen, So you can see this is a type 1, type 2 differentiating feature ମୁଁ ଆପଣଙ୍କୁ ଦେଖେଇଲି. But remember, my friends, all maximum cases, these are type 2 diabetes. Facts. I am just showing you facts. In type 2 diabetes, 90 to 95% people, those who have overweight, insulin sensitivity is less than 50%. Okay. And type 1 diabetes छोट ପିଲାମାନଙ୍କୁ ହେଇଥାଏ ଯୋଉମାନେ ଇନ୍ସୁଲିନ୍ ନଉଥାନ୍ତି and but type 2 diabetes ରେ common symptoms ଦେଖିବେ ଆପଣ ମୋଟାପା ଥିବ ପେଟ ବାହାରି ଥିବ ପେଟ ବାହାରିକି ବାରମ୍ବାର ପରିସ୍ରା ହଉଥିବ ବାରମ୍ବାର ଭୋକ ହଉଥିବ ଆପଣଙ୍କର this kind of symptom numbness unexplained weight loss ବେଳେବେଳେ ହେଇଯାଏ slow healing of the wounds constant hunger all these are the symptoms. Okay, these are the symptoms of typical type 2 diabetes, my friends. Okay, sometimes other types is called LADA, latent adult onset diabetes mellitus. Type 1 diabetes in adult is called LADA. So এই କେସ୍ରେ ବି ଯଦି ଦେଖିବେ ଆପଣଙ୍କ ସି ପେପ୍ଟାଇଡ୍ ଲୋ ଥିବ ଲୋକ ପତଳା ଥାନ୍ତି ବହୁତ ପତଲୁ ମାନେ ବହୁତ ପତଳା ଥାନ୍ତି ସେମାନେ and GAT65 antibody positive ଥାଏ ସେଇ କେସ୍ରେ. Another type is called FCPT, जोड़ा कि फाइब्रो कैलकुलस पैनक्रियोपैथी जोड़ा जो माने अल्कोहलिक थांती सेमानक केसरे देखा देते हैं मैक्सिमम केसरे मद जो माने पिउथांती and sometimes also to some because of some infections कौन हुए कि आपनक पैनक्रियास रे स्टोन ही जाए. Just showing the image of that pancreas रे stone ही जाए, right? So that stone creates the problem. Okay, and these are the different risk factors in diabetes. ଆପଣମାନଙ୍କୁ just basic ଜିନିଷ ମୁଁ ଦେଖେଇ ଦଉଛି. These are the major kind of NCDs, NRNCDs and all these things. So obesity କୁହନ୍ତୁ, diabetes କୁହନ୍ତୁ, cardiovascular disease କୁହନ୍ତୁ, hypertension, strokes. 90% of people dying due to this disease now. 90% people dying because of this disease now, right? ଏବଂ ସେଥିପାଇଁ ତାକୁ risk factor ଜାଣିବା ପାଇଁ ଆମେ କଣ କରୁ ଆପଣଙ୍କ କିଛି symptoms କୁ ନେଇଥାଉ ଆପଣଙ୍କର କଣ problems ହଉଛି basic some measurements ନେଇଥାଉ some testing କରିଥାଉ and sometimes also we install some CGM. See, there are some signs of diabetes. Okay, you can also type that. You can also know this thing. Acrocodons. ଭାତୁଡି ଯଦି ଆପଣଙ୍କ ବାହାରିଛି ନା ଏବେଠୁ ସତର୍କ ହେଇଯାଆନ୍ତୁ ଆପଣ just check your nape of the necks. Just check your nape of the necks. ଆପଣ ନିଜେ ଚେକ୍ କରନ୍ତୁ ଯଦି ଏମିତିଆ ସାଇନ୍ ଅଛି ଆପଣଙ୍କର ଏକ୍ରୋକୋଡନ୍ସ ଅଛି ରୋଜାସିଆ ଏକିନି ବାହାରୁଛି ବାରମ୍ବାର ହାକ ତଳେ ବ୍ଲେକିସ୍ ପେଚେସ୍ ଅଛି ଭାତୁଡି ବାହାରିଛି ଆପଣଙ୍କର and these are the blackish patches in the face. So understand, friends, this is you are going to develop the diabetes very soon. Okay, these are the some signs. These are the symptoms of diabetes. Yes. You can also type your symptoms in the chat box. ଆପଣଙ୍କ କୋଉ problems ଅଛି ଆପଣ just type in the chat box below. I just want to check that. ଆପଣଙ୍କ symptoms କଣ ଅଛି just type in the chat box below. I just want to check your symptoms. Okay, friends? Yeah. So these are the signs of insulin resistance, friends, and that causes problem. This is the diagnostic criteria of diabetes. Okay. ମୁଁ ଯେମିତି କହିଲି ଆପଣଙ୍କୁ HbA1c ଯଦି 6.5 above ଥିବ it is called diabetes. Fasting blood sugar ଯଦି more than 126 ରହିବ this is called diabetes. Plasma glucose after 2 hour ppbs is more than 200 it's called diabetes. Yes. Whole year pimples on skin. Yes. This is a typical sign of insulin resistance. Deepak Samantray Babu. Yeah. So many people, this kind of signs, symptoms, you should aware of all these things. Okay, you should aware of all these things. That's why we do this kind of testing, my friends. Yeah. That's why we do this kind of testing to know your current status of diabetes. ଆପଣ ଲୋକ ମିଷ୍ଟେକ୍ କଣ କରନ୍ତି only fasting sugar କିମ୍ବା PPBS sugar testing କରିବେ and they are not doing any testing and they are continuing their medicine 1, 2, 3, 4, 5 like that and that causes problem. Okay, so ଆମର programs ରେ ଆମେ କଣ କରୁ ବେସିକ୍ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ କରୁ ଯୋଉଥିରେ କି ଆପଣଙ୍କର କମ୍ପ୍ଲିକେସନ ଜଣା ପଡିଯିବ କଣ ପାଇଁ ଡାଇବେଟିସ୍ ହେଇଛି ଏବଂ ଆପଣଙ୍କର କିଛି କମ୍ପ୍ଲିକେସନ ହେଲାଣି କି तापरे आमे आपनकर बेसिक एडवांस को जाइथो हम प्रोग्राम्स रे ठीक अछि बिकॉज दिस HbA1c is a very gold standard test 3 monthly जोड़ा करा जाए and you can see our results so many patients those who reverse they have a very normal yeah. Some doctors diagnose as follicularity. What is the cause of follicularity? It's because of sugar, right? It's because of sugary food. Okay? Because diabetes is so many complications. Follicularity is one of the complications of diabetes. Okay? Because when sugar level is high, that causes infection, that causes inflammation, that causes bacteria to grow in your body. Yes, that causes bacteria to grow in your body. Okay? And that causes folliculitis and infection. Okay. And this is one of the main tests, right? Fasting insulin level. Fasting insulin level. Anybody have done this test, you can check that. Ideal, it should be less than 4. But nobody are doing this test. Normal less than 6. Okay. Borderline 6 to 10. Can just take a screenshot of this thing also, my friend. Because people are missing this golden test. That's why they cannot know their cause. Okay. Fasting insulin is the single most important predictor of development of type 2 diabetes. Okay. So how to measure insulin resistance? ଗୋଟେ ଟେଷ୍ଟ ଅଛି ଇଟ ଇଜ ଡିଫିକଲ୍ଟ ହେଇଯିବ ଆପଣଙ୍କୁ ହୋମ ଆୟାର ଆମେ କାଢିଥାଉ ଯୋଉଟା ଆପଣଙ୍କୁ ଦେଖଉଥିଲି and insulin resistance is the main cause of all these things. ଏବେ ଯୋଉ ରିପୋର୍ଟ ଆପଣଙ୍କୁ ମୁଁ ଶୋ କରୁଥିଲି particularly insulin resistance case ଟା ଯୋଉଟା so that will show you how much you are resistance now. In my programs I show that things to you. Okay, just ଆପଣ ଜାଣିଥାନ୍ତୁ ଯେତେ ଡିପ୍ କୁ ଯାଉଛନ୍ତି ଆପଣ ବେସିକ ଜିନିଷ ଶିଖିବେ ଦେନ୍ ଆପଣ ରିଭର୍ସାଲ ଟା ଆପଣଙ୍କ ପାଇଁ ଇଜି ହେଇପାରିବ ରାଇଟ୍ ହୋମା ଆଇଆର ଟେଷ୍ଟ ଯଦି ଦେଖିବେ ମୋର ଦେନ୍ 2 ଯଦି ଅଛି ଇଟ୍ସ କଲ୍ ରେଜିଷ୍ଟାଣ୍ଟ କେସ୍ ଓକେ ସେଇ କେସରେ ଆପଣ ଦେଖିବେ ଟିପିକାଲ ସାଇନ୍ସ ସିମ୍ପଟମ ମୁଁ ଯୋଉଟା କହିଲି ଆପଣଙ୍କୁ because this high amount of insulin causes all these disease stroke heart disease gout atherosclerosis and all these things my friends so that's why in my programs I do that test also so I hope कि ଆପଣ ମାନେ basic ଜିନିଷ ବୁଝିଗଲେ so always don't think medicine is best for me because medicine sometimes has side effect one of my mentor told uh, yeah pills thrill but could kill you also don't take a pill unnecessarily unnecessary pills ନେଇକି ଆପଣ life को बर्बाद करंतनी what doctors don't get to study in medical school you know I am also writing one book now what doctors don't know about diabetes reversal in medical school okay my book will publish very soon okay and today's final word is that ki, yeah your knowledge is your power your best security and gain it to beat the diabetes forever ମନେ ରଖନ୍ତୁ ଆପଣଙ୍କ जब तक knowledge ଟିକେ ହବନି ନା ଆପଣଙ୍କୁ କେହି ଡାଇବେଟିସ ରକ୍ଷା କରିପାରିବେନି ବୁଝିହେଲା ସେଥିପାଇଁ ଡାଇବେଟିସ ରେ ଗୋଟେ ଜିନିଷ ଦ୍ୟାଟ୍ ଇଜ କଲ୍ଡ ନଲେଜ ହିଁ ଆପଣଙ୍କୁ ଡାଇବେଟିସ ରୁ ପ୍ରୋଟେକ୍ଟ କରିପାରିବ ଏବଂ ମୁଁ ସବୁବେଳେ ଡାଇବେଟିସ କୁ ରାଇଟ୍ ଏଜୁକେସନ prevent diabetes complication ଲେଖିକି ରଖନ୍ତୁ right education can prevent your diabetes complication but no people are interested on this thing right friend so this is the basic task of today you know basic task in the sense ki first task is yeah save this number my number is this much and just WhatsApp me your name is with problems and any reports to my number. This is the day one task to you all of friends. Okay, this is the day one task. Save my number first. Yes. And please do it right now. ଏବେ ଆପଣ କରିଦିଅନ୍ତୁ କାମ ପଟିଯିବ ଆପଣ ଲାଇନ ରେ ଅଛନ୍ତି ଏବେ କରିଦିଅନ୍ତୁ ଆଜିର ଟାସ୍କ ପଟିଯିବ ଯେଉଁମାନେ ଦେଖିନଥିବେ ସେମାନେ ପୁଣି ଆଉଥରେ କରିବେ ମୋ ନମ୍ବରକୁ ଆପଣ ସେଭ୍ କରିଦିଅନ୍ତୁ ଆପଣଙ୍କର ନେମ୍ ଏଜ୍ ୱେଟ୍ ପ୍ରୋବ୍ଲେମ୍ସ and all these things ଆପଣ ମତେ WhatsApp କରିଦିଅନ୍ତୁ କାରଣ ଆପଣଙ୍କ ରିଭର୍ସାଲ ଷ୍ଟାଟସ ଜାଣିବା ପାଇଁ ଏତିକି ଜିନିଷ ମତେ ନିହାତି ଜରୁରୀ ତାପରେ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ ବିଷୟରେ ମୁଁ କହିବି ଆପଣଙ୍କୁ ଯୋଉ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ ର ଯୋଉ ଜିନିଷ ଦେଇଛି ମୁଁ ଆପଣଙ୍କୁ ବିକଜ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ ରେ ଏଥିପାଇଁ ମତେ ହେଲ୍ପଫୁଲ କରିଥାଏ କି ମୁଁ ଭିତରିଆ ଜିନିଷ ଜାଣିପାରେ ସେଥିରେ ଆଉ କଣ ପ୍ରୋବ୍ଲେମ୍ସ ଅଛି आउ किसी complication अच्छी की everything I able to know from that thing also. Okay, friends? Yeah. So please say that. Those who done this thing, just done in the chat box. Just type done. जो मैंने मते व्हाट्सएप कर देले एतिकी जिंस जस्ट टाइप डन इन द चैट बॉक्स एवं जो मैंने रेकॉर्डिंग्स भी देखुथुबे वीडियो रो एंड से माने भी चाहबे करबा पय देन दे कैन आल्सो डू दैट ओके एंड सेकंड टैक्स मु आपन को दोछि फ्रेंड्स those who posted the task to my number just type posted in the chat box okay just type posted in the chat box okay these are tags of day one okay just to know your reversal status just post these things to me okay yes because I'm just posting this task in the group also the day one task for all of you okay I posted in that group also Gola. Then second, what kind of test to done? Okay, second task is that is the profile testing things, right? Yeah, profile testing. If you want that, I also if you do this,
ସରିଲା ହେଲା ओके सो आई थिंक वीडियो आपण देखि पारथिबे बहुत इंपोर्टेंट जिनिस थिला मु जरा कहया को चाहतली आपनको बट जदि भी किसी आपन डाउट रही गला यू कैन जस्ट आस्क इन द चैट बॉक्स और मो संग लाइव कथा ही परिबा आप माने प्लीज यस आई होप आपण देखिथिबे बेसिक वीडियो सो किसी डाउट रही गला आपनकर आज डे 1 रे ओके तापर डे 2 डे 3 डे 4 अछि भी हमरो बर डे 1 रे कोन आपन जदि डाउट रहिला जस्ट आस्क मी इन द चैट बॉक्स ओके प्लीज हां शिवशंकर सर देखिले शंकर प्रसाद सर या
यस सर
सो
देखिली भल लागिला वीडियो
नंबर नोट कर देले आपण कोन पे
नंबर नोट कर देछि सर
वेरी गुड सर सो प्लीज डू द टेस्ट काली कॉल करी कर दियंतु टेस्ट हला
सर
परे मु आपन को 1 टू 1 कंसल्ट करिवे सर ठीक अछि
सर वन मोर थिंग सर
सर प्लीज
डायरेक्ट एडवांस टेस्ट जोटा कहले ता भितरे ए सब टेस्ट आसीबो
यस एवरीथिंग
होमा
विल कम
एयर टेस्ट
यस यस
सर सर थैंक यू
एवरीथिंग विल कम सेति में हम पैकेज कर देजु ताको गुटे ठीक अछि या
ओके सर
नेक्स्ट
एयर किछि संबलपुर किंबा बुल्लारे किछि अछि कि सर
हाँ संबलपुर
लैबोरेटरी जो जागे सब टेस्ट
कलेक्शन सेंटर अच्छी सर आपण जस्ट से नंबर कॉल
ओके
कले संबलपुर लोक आपण घर को जाके ब्लड कलेक्शन करके आपण को पठे देबो सर
ओके
एबे
थैंक यू सर
तार प्राइसिंग टा एक्चुअली हमें दुई तीन टा टेस्ट को टिके बढ़ाई छु सो 3500 टोटल पड़ू सर एबे टोटल
ओके नो इशू सर
बिल्कुल बिल्कुल कर दियंतु कला परे आई विल डू 1 टू 1 कंसल्टेशन सर एंड
ओके
लास्ट को जो इमेज देखेले आपनकर जो टेस्टिंग हैला परे आपनकर रिवर्सल स्टेटस जानिया पे आउ कोन करियो पड़िबो डाइट कोन चेंज करियो ता ऊपर मु आपनको डिटेल्स कहबी सर ठीक छै
सर
तो एनी अदर पार्टिसिपेंट्स एनी अदर डाउट्स आई थिंक प्राय आज तो देखि दिथिबे आप माने सो काली पुनी आमे सेही सेम टाइम रे आसीबा एंड 9 टा रु 10 टा सो आपण मिस करिवेनी एंड जो लिंक भी थिबो से लिंक थ्रू जॉइन करिकी बेले हमर जूम जूम रे हुए बेले बेले हमर वेबिनार किट रे हुए सो जो लिंक आपन को दिया जेबो सेही लिंक थ्रू जॉइन करिवे आपण एवं कंप्लीट वीडियो देखिबे सो दैट आपण जानि परिबे कोन एक्चुअल जिंसडा एटा बहुत रंगर ए विषय नॉलेज ही नाही बुझी पर डायबिटीज कोन रिवर्सल कोन होमा एयर कोन एंड ऑल दिस थिंग ए बहुत इंपोर्टेंट जिंस मोस्ट मिसिंग टेस्ट नाउ इट इज जोड़ा आपण आगरु दि कर देबे 10 वर्ष आगरु प्रिवेंट कर दे डायबिटीज को ब्लड प्रेशर को कैंसर को बहुत गुड़े जिन हम प्रिवेंट कर दे परिबा ठीक अछि सो आप माने प्लीज डू द टेस्ट एंड काली आमे पुनी ए 9 पीएम टू 10 पीएम पुनी कथा हेबा मो रेकॉर्डिंग वीडियो रो सेंड कर देथिबी आप माने अन्य मानकू आम वीडियो रो रेकॉर्डिंग शेयर कर दियंतु जोटा कि बहुत हेल्पफुल हे परिबो अन्य मानकू प्लस आपण आउ थरे भी ताकू देखि परिबे